Imagine a person sitting next to you, or the person being your best friend. You would never even get to know that person. I'm going to inform you of the pros and cons of abortion. There are some of the main points that I want to discuss about abortion. I want to talk about the way that the baby feels during the process, the unhealthy relationship that the baby can have with the mother, the potential health problems that can be caused from the procedure, and the chances of the mom having more than one abortion. Many people don't truly understand how abortion affects the baby during the process or what really happens to the baby. The first point I want to discuss is how the baby feels during the procedure. Abortions can be a very painful thing for babies. After 8 weeks of the development, the baby can feel pain. The baby can experience both psychological and mental pain. Dr. David Prentice stated, "Young babies still in the womb at 20 weeks after conception and probably even earlier do indeed feel pain. And in fact, many feel more pain than a baby or an adult. Many babies now are given anesthesia to prevent pain during the procedure. Due to the fact that abortion causes pain, there was an act made by a Californian assemblyman. This act was the Fetal Pain Prevention Act of 1998, which stated that babies were required to be sedated to reduce the suffering of pain. The act was not passed. It wasn't until the last 10 to 15 years that doctors really thought newborns even experienced pain," stated Dr. Prentice. "Knowing that babies experience pain during abortions, they sedate them, give them anesthesia, or they give them medication to help them feel less pain. This helps both the mother and the baby. With new medical advancements, abortions cause little to no pain for babies." The second point I'm going to discuss is the unhealthy relationship the mother and the baby can have. The mother could have the best relationship with the baby or the worst. The relationship that the mother and baby share is very important to not only them, but the family as well. No baby should come into this world unwanted. The relationship between the mother and father is important as well. Few people realize that coerced abortions take place. With that being said, coerced is when one of the spouses persuade the other spouse to have the abortion. If one of the two parents or both of them don't want the baby is most likely not going to get the time, attention, affection, or the nutrients that they need to survive. Some women are forced to have abortions, and others don't want a baby. David Grimes stated, "Unwanted children are at increased risk of juvenile delinquency. Women who have an unwanted baby have difficulties accepting the baby." Mr. Grimes also stated, "Another study found that a third of the women denied abortion harbored long-term resentment of the unwanted child. Since only a few babies are given up for adoption instead of aborted, most mothers just take the baby whether they want it or not." The next point I'm going to discuss is the potential health issues a woman can have during an abortion. Abortions can be a very important and scary time to the mother and the baby. They are also very scary to have done. More than 100 complications have been associated with induced abortion. Minor complications would include infection, bleeding, chronic abdominal pain, and vomiting. These complications are not the worst, but they are pretty critical. The major complications are infection, excessive bleeding, embolism, ripping of the uterus, anesthesia problems, hemorrhage, cervical injury, and endotoxic shock. Women have also experienced mental hurt. They can get depressed, lose self-esteem, self-destructive behavior, sleeping disorders, memory loss, sexual dysfunction, chronic problems with relationships, anxiety attacks, guilt, and they can be more violent. And they can also experience more flashbacks. All of these are pretty serious. The ones that stand out the most are the anxiety, loss of self-esteem, and the self-destructive behavior. Few women that have had an abortion have died, but it has happened in the past. The final point I'm going to discuss is the chance of the woman having multiple abortions. Roughly half of the women who have already had an abortion have another one. The Guttmacher Institute reports that characteristics of repeat abortions. Susan A. Cohen states, "The unintended pregnancy rate in the United States is so high, and many women experience repeat unintended pregnancies. Some of the women have their babies from unintended birth, and others have abortions. Reducing the abortions would mean that they would have to reduce unintended pregnancies." Stated by Ms. Cohen of the Guttmacher Institute, about 1/3 of all U.S. women will have had an abortion by the age of 45. Most women that have an abortion are already mothers. Most are having their first, second, or third abortion, were using contraceptives when they got pregnant. Numerous women use abortion like it is birth control. Women are trying to avoid unintended pregnancies, but they are not succeeding. According to Guttmacher Institute, almost 1/3 of all women ages 15 to 44 report having had an abortion from at least one intended birth. With that being said, I feel that I am qualified to give this speech because I have done research over this topic. With newer technology and equipment, babies do not feel nearly as much pain if they are at all when abortions are done with medication and anesthesia nowadays. Unhealthy relationships between the mother and the baby can be crucial to the family and are not always the mother's fault that the abortion takes place. Women all over the world go through mental and physical pain from abortions. Some women even have further complications such as death. Many women have at least one unintended pregnancy throughout their life. The women that are having an abortion are most likely have had a child or have numerous children. So the next time you see your classmates or friends, be thankful for them. Abortion is a very hard process for anyone, and it can be hard for anyone to imagine being aborted.